I'm Dr. Khurrum Shaukat Yusafzai, Hyperbaric Medical Consultant. There is a myth in the minds of people about FDA and non-FDA hyperbaric diseases because they think that non-FDA diseases are not legal to be treated by hyperbaric medicine, which is a wrong and it's a myth. So today's video is going to dispel these theories and myths, and I'm going to explain about FDA. FDA is Food and Drug Administration of the North America. North America is divided into North America and South America. So FDA only controls the affairs of medicine in the continent of North America. And it is entirely not responsible for controlling the aspects of hyperbaric medicine. The hyperbaric medicine is controlled by some other scientific bodies and societies, which I will explain in this video. And I will also explain the difference between FDA and non-FDA diseases. So let's begin. The off and on label division of the diseases by hyperbaric medicine. So on label diseases are those diseases which are paid by the insurance companies, and they are approved by the FDA, Food and Drug Administration of the United States of America. And most of these diseases are emergencies in nature. The second category are off-label diseases. They are paid by the patients themselves, and they are those diseases which are not the on-label diseases, meaning the rest of the diseases, and they are perfectly legal to be treated if prescribed by a hyperbaric physician or a doctor. The on-label diseases being treated by the hyperbaric medicine are those in number. The diseases that are treated by hyperbaric medicine are divided by continent wise. For example, in the continent of America, especially the North America, UHMS, the Undersea and Hyperbaric Medical Society of the America, approves 14 diseases in 2011 to be treated by hyperbaric medicine. And in 2014, these diseases increased to about 17, which are FDA listed. Same is the case in South America, but in the European continent, the EUBS, European Underwater Biomedical Society, treats about 40 diseases. And these diseases are then further divided into recommended, emergencies, and other indications. SPUMS also follows the European continent. But in Asia, the hyperbaric indications are about 60 in number, and 12 of them are emergencies and 48 of them are non-emergencies. So they are pretty free to be treated, and especially in China and most of the Southeast Asian countries. On the continent of Africa, it follows the protocols of the USA FDA, which are 14 diseases on label. But in the Middle East, the country of Israel is pretty different because most of the off-label diseases are also treated free. But in the Arab Gulf countries of Middle East, they follow the US protocols of the FDA. That means only 14 diseases would be treated for free by the medical insurance companies. On-label FDA-approved hyperbaric indications are 14, although they are now expanded to 17, but I will describe the 14 indications. They are hyperbaric treatment of air or gas embolism, arterial insufficiencies, carbon monoxide poisoning, clostridial myonecrosis, gas gangrene, effect of hyperbaric oxygen on compromised grafts and flaps, the role of hyperbaric oxygen for acute traumatic ischemia, decompression sickness, and delayed radiation injuries, sudden sensorineural hearing loss, intracranial abscess, necrotizing soft tissue infections, refractive osteomyelitis, severe anemia, and the last is adjunctive hyperbaric oxygen therapy in the treatment of thermal burns. So I just explained the FDA diseases. Now I'm going to explain the non-FDA diseases and what they are. In conclusion, I would like to say that the on-label diseases as described are 14, but the rest of disease are off-label and would be paid by the patients and are perfectly legal if prescribed by a hyperbaric doctor. And the myth that off-label diseases are something illegal is not true, because if a hyperbaric doctor prescribes these indications, then you are perfectly eligible to take this treatment, even if the medical insurance companies do not pay for it. One can pay by cash or by one's pocket for these diseases and perfectly get cured. Just because the insurance companies are not paying for it does not mean they are not legal. They are perfectly legal, actually. And in the end, I thank you very much from Dr. Khurrum Shaukat Yusafzai for listening to my presentation, and I hope to see you soon on my next presentation. And I hope the myth has been dispelled that off-label diseases are something which should not be taken, by understanding what divides them into label and off-label. It's only the continent of America where FDA has restricted it. As you can see, in the rest of the continents, people are taking more than 14, like up to 60 to 40. Like in Europe, it is 40, and in Asia, it's 60 indications, which are perfectly free. And Israel treats most of the diseases for free in Africa. So I hope the confusion has been cleared. So at the end of video, I would like you to subscribe to my channel to get information about hyperbaric medicine, which would be very useful for you. You can contact me on the social media apps scrolling down below, and I will gladly answer your query. And you can visit my website for any consultation on the matters of hyperbaric, like installing a chamber or consultation on any hyperbaric disease, or you want to know about the medical documentation or anything related to hyperbaric medicine, like the IT softwares or the medical documentation, the standing operating procedures, or even buying a chamber. I can provide consultation on all these matters. So you can consult me on the social media apps scrolling down below. And I hope to see you in the next video. Take care. Goodbye.